Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
That's enough, Shot. Welcome back. We are positioning our fluoro machine, Shot, for treatment, Shot, of this patient's facet joint at L4-L5, Shot. And I feel like there's a lot of scar tissue, by the way. I think that's it right there, huh? Yeah. I'm right on the transverse process. You guys see the transverse process right there? And my probe is literally sitting in the perfect spot where the pain nerve is. But we had to do an interesting view here, which went kind of from the other side and looked over. But he has a fusion there. I've just treated that fusion. I've just treated the facet joint above the fusion. So he has adjacent segment disease above and below his fusion. He went back to his doctor in Pittsburgh. They wanted to do more fusion. And he said, the heck with this. He finally wised up. He said, Dr. Deuk, I wish I knew about your Deuk Spine Institute before I had this invasive fusion surgery. Fusion surgery, folks, are really surgeries that benefit the surgeon more than they benefit the patient, okay? Patients are having fusions because their doctors are recommending it for their back pain, neck pain. But doctors are recommending it. You're fine, Jordan. Doctors are recommending it because they make the most money doing fusions. That's not what's best for the patient. You see, surgeons know about the Deuk laser disc repair. It's been peer-reviewed and published. It's in the National Library of Medicine, and we've been performing this surgery now for 20 years. And we've been telling other surgeons about it, but the problem is it doesn't pay the surgeon not nearly as much money as does fusion or spinal cord stimulators. Spinal cord stimulators pay surgeons a lot of money, and that's why they're recommending those devices so commonly to patients with pain, because the payment for the procedure is so lucrative. Fusion is the same way. If you want to get paid a lot of money for treating someone's back pain, you're going to do a fusion, artificial disc, stimulator. Those are the kind of invasive surgeries that pay the surgeon a lot of money. However, those treatments are not what's best for patients. Henry, did we show the audience how we treat facet joint pain?
Yes, we did. Yes, we did.
Thank you. Just about done with this medial branch of the dorsal ramus here at L4, and I'll move on to the next one below. After we're done with his facet treatments, we're going to go on to the SI joint. The SI joint is a very common source of back pain. And Henry, what do you think? Should we stop the broadcast and do the SI, or should we just keep going?
I say that we keep going with this one, but when it comes to the piriformis, we can switch over that.
Fine. Shot? That's fine. In that case, then let's do that. Let's go ahead and go with, just run it as we go to the SI joint. All right, I'm
Copy that.
on the bone here. Huh? Shot? What are you saying, Jordan? All right. We're done with L4-5 facets. We're going to move on to the SI joint. He has bilateral sacroiliac joint dysfunction or pain. How is he doing, Dr. B? The incision we've used for these procedures is 4 millimeters. It's tiny. All right, we're going to get started on the SI joint. If you have questions, feel free to ask, but because he's had a fusion before, he now has pain above his fusion and below. Is that the most recent picture there, Shot? All right, let's go north a smidgen and towards you a smidgen. Shot. Definitely not at one of my easier cases, huh? Right there. Actually, right there. Uh-huh. Any questions from the audience?
At this moment, no current questions.
Let's show the audience how sacroiliac joints become injured and painful. Shot?
Sacroiliac joint injury is a common cause of chronic back pain. The inflamed sacroiliac capsule tear generates pain signals. The best treatment for sacroiliac joint pain is the Deuk plasma rhizotomy. Sacroiliac joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
And welcome back. You can see how the SI joint becomes injured through trauma, some type of a slip and fall or car accident or sports injury. And then you tear the capsule around the joint, and over time, that thing just keeps hurting and hurting because it never heals. The connective tissue never grows back together. What happens is you keep re-injuring that tear and re-tearing it, and arthritis or inflammation sets in. And over the years, that inflammation just causes the joint to become very painful all the time. And that's kind of what we're dealing with here, is a very painful joint. And so, yeah, that's why we're here. We want to go in and destroy the pain nerves to the joint. There are 5 of them. They come out of the foramen called the sacral foramen. And they're just sensory nerves. They don't have any motor functions. They don't control anything but pain. And so by us going in here and destroying these pain nerves, we're able to eliminate the pain that the patient has from the SI joint. That's the idea. Did they see all that, Henry?
Yes, they did.
Now, what I can tell you is that for me, yeah, I mean, don't worry about that. For me, I mean, I'm fine. I can get a moving target. You just keep them safe. That's all that matters to me, safety of the patient. So the biggest problem with sacroiliac joint rhizotomy or radiofrequency ablation, which we're not doing, by the way, is that it doesn't work because, Sean, number one, the probe being used is way too small, way too skinny, Sean. And we need a probe that is more powerful than a radiofrequency probe, Sean. So we use a more powerful probe, electrocautery probe. And as such, we're able to destroy the pain nerves more effectively, whereas the RFA cannot do that. Any questions?
Yes, we got a question, or it's seeking advice from Rosa on Facebook,
Sean?
saying that I have disc protrusions at every level from the last thoracic through S1.
Sorry to hear that. That doesn't mean they all need to be treated, though, Rosa. We want to treat the ones that are causing pain. Sean? So, Rosa, what you need to do is do our free MRI review. It's free. You don't pay for it. And it's done virtually, so you can do it online. You just need a little bit of time, 10 minutes, to get your diagnosis about what's causing your pain. Henry, will you put the link for our free MRI review?
Already did?
Thank you. Just use that link, Rosa, to fill out our brief form so we can contact you and set up a free consultation. And we'll need your MRI images. So if you have a CD or a USB drive, we need that. Not too hard, though. All right, we're going to come back for a piriformis release. Nice meeting with all of you. Thank you for joining us.